So without further ado, I'd be really excited to take you through the new site. This is the home page. You can see now with pricing information on explore your coverage options here. So let's actually take this for a spin. So let's say I am a young woman in Los Angeles, California, looking for insurance. So I'll pick my state, hit go, and now I get asked a few additional questions. Am I a healthy individual? Let's see here, okay. I need health insurance. I'm 25 years old. Do any of the following apply? No. Do I find it difficult to afford insurance? Yes. Submit, and then boom. Healthcare.gov, as it has since July 1st, generates, based on those questions, a customized list of both public and private coverage options that may be right for me. So first of all, I learn that thanks to the Affordable Care Act, as of September 23rd, I actually am eligible potentially for coverage under my parents' plan because I'm 25. I can get health insurance through work. I can get health insurance on the individual and family market. I can learn about a public program called the Pre-Existing Condition Insurance Plan, Medicaid, et cetera. But the part I want to focus on is the private insurance. So here's the brand new private health insurance plan landing page. It gives you some information to orient you to the insurance market and what insurance is all about. There's an online tutorial to help you learn how to use this private insurance search tool. Let me go ahead and get started. So now I get asked a few additional questions just to help Healthcare.gov figure out options for me. So Los Angeles, California, zip code 90016. I want coverage to start November 1st. I was born, let's see, June 21st, 1985. I'm a summer solstice baby. I'm not a smoker. And one actually very important point which we actually note here is that these are questions which are a bit sensitive. And one of the things that healthcare.gov wants you to know is that it's not keeping any of this information. The government is not keeping any of this information. This information is only being used by the site to generate the list of options you'll see next. And then when you leave the site, the information gets flushed. So hit submit. Now as it searches for plans for me, it actually displays a few messages that are important to keep in mind. We're not recommending specific plans to you. The actual premiums you get may be higher than the estimates you see here based on your health status until 2014. And until 2014, until the Affordable Care Act is fully implemented, you may still be denied coverage based on your health status. So these are just cautions to have in mind as you go into your search experience. Then show me the plans, and then boom, I see that I have 56 possible private insurance plan options in zip code 90016. You can see each of the 56 has a little index card that summarizes the plan. And in each index card, you can see key information like maximum out-of-pocket cost, annual deductible, prescription coverage. If you don't know what this means, there's a little pop-up that explains in English what this actually means to help you better understand what's going on. And here on the right-hand side, you can see monthly premium estimate. Premiums start at, for a young woman, 25 years old, in zip code 90016, who's not a smoker, premiums start at $245 per month, but you may be charged more. And we explain that the actual cost of coverage may be higher than the estimate because right now insurers can charge more in most states than this base rate based on your health status or other factors. A surge charge quote is one that actually has been adjusted in this way, and this can make your costs much higher. Also notes that actually under the Affordable Care Act, starting in 2014, this won't happen anymore, but for the time being, it's something you actually have to keep in mind. So you can see here that 10% received surcharge quotes, and 38% of people who applied were denied. So that's something else to actually keep in mind and understand. So let's say I'm actually wanting to search and sort here and try to narrow down my choices a bit. So I can actually sort this list of 56 plans by a variety of factors: maximum out-of-pocket cost, monthly premium estimate, annual deductible, enrollment. We actually picked maximum out-of-pocket cost as opposed to monthly premium estimate because research over the years has shown that's one of the most important factors when you buy insurance, and it's actually consistently underrated by consumers who always seem to gravitate overwhelmingly toward the premium and not think as deeply about the protection being offered, with maximum out-of-pocket cost, the maximum you can pay out of pocket in a year being a really important component of what that protection means. And so we actually default to maximum out-of-pocket cost based on recommendations from a bunch of experts like the great Karen Politz and Michael Robluski of formerly of Consumer Reports and others. But you can actually, if you want, go low to high on just the monthly premium estimate. So let's just say I'm going to do that. What's the very cheapest plan I can find in the zip code right now? And I see Optimum Advantage HSA 4500. So let me learn more about that plan. I can click on Plan Details, and it pulls up a summary of this plan. And this was actually, again, derived from a bunch of work that's been done over the years by folks like Karen and Mike Robluski and others, and been designed in a way to make it maximally easy for a consumer to understand what this plan actually contains. So I can see that the premiums start at $66, but I may be charged more, I may be turned down. And while this is really cheap, wow, deductible. What is a deductible? Deductible is the amount I have to pay each year before my insurer begins to pay. Okay, that seems like an important number. That is a lot of money for me. Maybe not for other people in LA, but for me, that's kind of a lot. So let me keep looking. This section is actually very cool. Look, I can actually see here common medical events, like if I'm sick and need to go to the doctor's office, if I have an emergency. In those common medical events, what services I might need, like a primary care visit or an outpatient x-ray, and then for each of those services, what my cost sharing actually is. So as I scroll down here and look through different scenarios, I see, oh, if I become pregnant, not covered. Okay, well, that might be okay for some people, but for me, I'm not really thinking about a baby right now, but I certainly don't want to preclude the possibility of having one in the future. So you know what? I actually am not so sure that this really cheap plan is the right one for me personally. So you know what? I'm going to keep searching. So let's go back to the main list. I'm going to bookmark this, add it to my comparison cart here so I can do a head-to-head comparison, which I'll show you in a second. And then I'm going to try and narrow my results and filter a bit further. So on the left-hand side here, you can see the ability to actually narrow your results and show only the plans that are between this range for maximum out-of-pocket or that range for deductible. So I'm going to say, okay, look, if I look at my budget, think about it, et cetera, I think I could afford actually premiums that are between $200 to $300. And maybe those are plans that have a bit more protection for me because I really want a bit more protection than that first plan offered. So I'll click on that. Filters the 56 down to 14 private insurance plans, the zip code 90016, that have premiums between $200 to $300 in terms of the starting estimate. And I'll pick a couple. Let's see, one of these plans here and then one of those plans there. And I can hit click to compare. And then boom, this is personally my favorite screen, which is the ability to compare these three plans I've selected head-to-head against each other against each of these key dimensions. So I can see the premiums, 66 to 13 to 17. I can see some very interesting stats here in terms of estimate accuracy and how many people are denied. On deductible, I can see that, whoa, remember this $4,500 one was the first one I looked at, but these are much lower deductibles, which is cool. And as I scroll down to look at if I become pregnant, not covered, not covered, covered. Okay, so I'm starting to like this deductible 25 1000 plan. Let me just check it up again here. Looks like there's mental health coverage, looks like there's drug coverage, looks like there are doctor's offices visits covered. And again, I'm liking this deductible. It's $1,000. It's more my speed. And I think I could afford that. I think I keep in mind that I might not be accepted, but I'm going into this with my eyes wide open with the right information, I think, to make a good decision. So at this point, I can actually contact the insurer for more information and take it from there.